Well, good morning. Appreciate you being here. So my name is Joshua Swift, Forsyth County Health Director. And first I want to start out with thinking back a year ago. On March 12th, 2020, we had our first 2 cases of COVID-19 in Forsyth County. There was a lot of planning before that with our communicable disease team, with staff, emergency management, partners, because we saw the virus coming across on the West Coast, and we knew it would be here before long. So, it's really monumental when you think about all that's happened in the past year. We've had over 32,000 cases. We've had 350 deaths. But now, in the past 90 days, the vaccine rollout, we were one of the first counties in the nation through our hospitals to get the vaccine. Now, so far, the Department of Public Health has given over 49,000 doses of vaccine to our residents. We have seen well over 15% of the county's population get their first dose of vaccine in Forsyth County. So it's really an exciting time, an exciting moment to be here with our partners, to look at this vaccine clinic that we have here at the Education Building with the Winston-Salem Fairgrounds. We started here late January, and this event this weekend with the Johnson & Johnson vaccine, where we're going to vaccinate over 8,000 people, partners with the Novant and Baptist. It's really exciting, and I just appreciate the support of these 2 partners, all our partners in the community that have worked hard from the early beginning when we were doing contact tracing, we were doing case investigation, then testing, and now the ability to roll out this vaccine to help our community. A few other points I'll just wait till you have questions later on, and I'll just introduce Dr. Ohl, who's one of our medical directors at the Department of Public Health, but most known as being from Wake Forest Baptist Health. Dr. Ohl.
Good morning. What an exciting time to be here with our partners in the community, public health, and from Novant Health. I've never been more optimistic during our pandemic that we really are in the ends of the throes of the ends of the pandemic, and that's because of vaccines. It's really incredible that, the virus has so much that it uses to infect and to spread amongst the population. Evolution, biology, and it's a sneaky little guy. But we as human beings have ingenuity and technology and science all of our own. And over the last year, we've taken ongoing vaccine development strategies that we've been doing for years and moved them into COVID vaccinations. And now we have 3 very highly effective and very safe vaccines that we can use for COVID. Our vaccine penetration is now getting to a point where we have seen huge gains in the numbers of people that are being admitted to our hospitals, particularly our ICUs. In our ICUs, we're seeing about a 1/5 to a 1/6 of patients than what we saw 6 weeks ago, and that's incredible, and vaccines are largely to account for that. At this event this weekend, we're going to vaccinate more people. We're going to vaccinate over 8,000 people from our region, and that is a big step forward. We're using the Johnson & Johnson vaccine. This is a vaccine that came from technology that's been developed over decades and was put into practice for COVID about a year ago. The vaccine is a vectored vaccine, not a live vaccine, and it's extremely effective and safe. Here's how effective it is. If you get this vaccine and you are exposed to COVID, you have a 0% chance of dying, according to the clinical trials. The odds of you going into an ICU are extremely small, and hospitalized almost negligible. So this is huge. And so I really encourage people to step forward and get vaccinated. I saw some data the other day that if you're looking at a community where COVID is spreading in the community, and you as an individual who's been vaccinated with the Johnson & Johnson vaccine have a less than 0.5% of a chance of getting COVID. And that's incredible. So the vaccines we have out that we're using this weekend are effective and safe, and I'm really happy to be part of this event here at the fairgrounds for our region. And I'd like to introduce one of our partners and a close friend, Pam Oliver from Novant Health, who's going to talk a little bit about how our community partnerships are working.
Thank you, Dr. Ohl. It's a pleasure to be here with all of you. I'm Dr. Pam Oliver. I am Executive Vice President of Novant Health and President of our Physician Network. So I've had the pleasure of leading our teams this past year with our screening and our vaccination efforts. It is hard to believe that it was just around a year ago that we first were facing COVID in our communities, and that we actually were able to set up screening sites throughout this community to try to identify and contain this pandemic. All that time, we were waiting for hope, and that hope is now coming in the form of a vaccine. We've collaborated, our three organizations, the Health Department, Wake Forest, and Novant Health, many times in the past, but this pandemic did offer a new opportunity for us to come together for our community. And that's the core of what we all hope to achieve and why we exist, is to help take care of our community. And so I'm incredibly proud of this collaboration and the partnership, of the relationships that we have deepened over this past year, and even now with this new vaccination effort that we have launched in the community. We are all committed to getting this vaccine into arms, to ending this pandemic, to making sure that there is equitable access to this vaccine throughout our community. And so this event this weekend, with 8,000 Johnson & Johnson doses being administered to our community, is a huge step. It's a huge step towards progress and getting our communities back to normal, and we're incredibly proud of this partnership. And I want people to know that if you do not have an appointment for this weekend, if you do not have an appointment already, we will get to you. We will bring this vaccine to you, and we are committed to making sure that we vaccinate as much of this community as quickly as possible. So I'm very proud to be here today, and I'll turn it back over to Josh, and we'll answer any questions.
Yeah, so thank you, Dr. Oliver. Thank you, Dr. Ohl. Again, we appreciate this partnership. We appreciate this opportunity to help protect more citizens in Forsyth County and the surrounding area over this weekend event. And as Dr. Oliver said, we've been partnering with all three of us for decades, but this pandemic, I think, has brought not only the three of us together, more closely aligned, also our whole community. We couldn't do it without our community partners. We couldn't do this without the staff that are working behind us in public health and in both hospital systems who are making events like this happen, testing in the summer, throughout the fall, and it's still going on, contact tracing. So it's been a total team effort. So right now we'll be here, and I'll be happy to take any questions.
So I'll say a couple of things. The allocation process from the state has been very nuanced and complex from the beginning, and the state has made it clear that they want to make sure that we partner to make sure that the community is taken care of. And I would say early on, we identified that that was absolutely the best strategy, because our ability to get out in the community was going to be better if we shared our plans and we figured out where we may have had overlap and where we were where we were missing. And so a couple of ways. One, it helps us with our business case to the state to actually get more vaccine allocated here. And you'll see more of that coming, where they actually value this partnership. And so it's going to mean more vaccine for this portion of the state. It also meant that we can get to different parts of the community more effectively and know where we're missing, and we share data. We've actually brought in other health department directors or other counties to identify those areas, because we know Forsyth County is the center of an entire region that we seek to serve. So.
So this weekend, in partnership, Baptist Hospital is using a barcode scanner Every individual that comes here to get their vaccine that has an appointment there will receive an email 24 hours before their appointment with a barcode. So we're implementing that new system. But normally, in a normal day, through the health department, the process we have here, from the front door till you get your vaccine, you wait 15 minutes. In total, it's 30 to 45 minutes. Now that's a normal day here is 1,500 individuals. Saturday and Sunday will be 3,500. But we have that new barcode system. We also have staff from both hospitals here. But we're hoping, and our goal is to have that same turnover of 30 minutes a person. Yes.
We were told about that FEMA will be selecting a spoke site for the Greensboro Clinic in Forsyth County. Is that goal to help reach underserved, marginalized communities?
Yes, that is true. There is a spoke site that will be opening next week with Baptist and Novant operating 1 day a week at that spoke site, as well as there will be doses that will be distributed into the community that the health department and Baptist and Novant will go and do mobile outreach, which we've already been doing in the community, but that will bring more doses into Forsyth County to help us reach our historically marginalized population. And while we're there, this weekend's event, which is 8,400 doses, appointments, we will serve approximately 30% will be from historically marginalized populations. The spoke site, it will be at the Anderson Center at Winston-Salem State, and both Baptist and Novant will be operating that spoke site on their separate days, and they will be handling the appointments for those events. And do you have any other items? Okay. At those sites, I believe it's approximately 600 per day at those sites.
So the only thing I'll add to that is that was another benefit of the partnership, is to bring money outside of our state allocation from a federal allocation to allow us to bring that specifically into this county. So Greensboro at the Four Seasons Mall will have the hub, which will do a large number of vaccines, but we will actually be bringing into this market about 3,500 extra doses per week that we will divide, and a good portion of those will be done at Winston-Salem State at that site, and the remainder we will do through those outreach efforts, whether it's through community partners or churches at other events that are truly positioned to be able to get to historically marginalized populations.
A little more than double. Normal is 1,500, so this will be 3,600, so a little more than double. Well, it's going to be roughly the same hours, 8:30 to 6:30. That will be appointments. People need to come no more than 30 minutes before their appointment because we have a throughput per slot. We're using a barcode system, as I said, where people will get their barcode emailed to them, so they need to come with a paper copy or on their phone or tablet, and that'll be a scanning process that should be a much quicker process. Plus, we have a system that was demoed by Baptist at a previous location, where in the pod there will be a scribe with a iPhone that can ask the same questions that we ask. So we're using more staff and more technology to get more people through. We hope to be able to take some of the efficiencies that we gain here and use them going forward. Again, the rate limiting factor is the amount of vaccine. The joint partnership where we were able to get the over 8,000 doses here was a one-time allocation. So as we get more vaccine, we hope to be able to do that, but it all depends on the amount of vaccine we can get.
Yeah, so the 3 vaccines that we have right now are all highly effective and safe. And personally, I would get any one of them, and I really wouldn't spend a lot of time picking or choosing. The best vaccine that you can get is the vaccine that you can get the quickest. And because of the way the allocations work, sometimes it'll be one company, sometimes it'll be another, sometimes messenger RNA, sometimes vectored. And those allocations get pushed out. If you got an appointment Take the one you're offered, because the reality is they all are going to protect you from serious COVID disease, and they're also going to prevent transmission. We're learning a lot in the last few weeks that that not only do the vaccines protect you, but they also protect the people around you in the community. So in the last week or so, I've seen data that vaccines reduce asymptomatic infection. Vaccines, it looks like, are reducing transmission from one person to another. So they're slowing the virus down. So it's not all about just protecting you, but getting vaccinated helps your whole community get protected as well. So get the vaccine you can get when you can get it the earliest. Yeah, so the question is the transmission rate come down low enough? Are we on the right track? Yeah, we're on the right track. I mean, right now, our hospitals have already seen the benefit of vaccination. That's just clear because, you know, the highest risk people were the people that were in the first priority groups. And we have roughly 60 to 65% penetration now in people over the age of 65. And because of that, they were 80% of our hospital admissions. So because of that, we've been able to reduce considerably the stress and strains on our hospitals with vaccination. So the next step is to go into phase 4 now, which starts next week, to get people with underlying medical conditions vaccinated as well. So when that rolls around next week, people will be able to sign up and get vaccinated who see doctor. Basically, it's people who see doctor for a medical problem. And then we'll be able to reduce more serious infection in that group as well. So, yeah, we're definitely on the right track. The question I get asked all the time, though, is have we hit herd immunity? And it's a little bit dodgy as to how much percentage of people we need to have vaccinated or previously infected. Somewhere around 80% maybe. We got a ways to go on that one. So there'll still be some COVID in our communities. We'll still be masking. We're going to still be doing social distancing. We're going to still have to keep the numbers we get together in what I call bubble fusions, one household and another, down to a minimum. And we've seen the CDC recommendations this week on what vaccinated people can do with getting together and friends and family. So yeah, we're clearly on the right track.
Have any other questions? The first appointment today is at 3 p.m. Today we will see 1,000 people from 3 to 6 p.m. Any other questions? Okay, if not, I appreciate you being here. Thank you.